Hi, and welcome to Chapter 4, Upper Limb. We are going to continue this chapter and talk about the forearm and elbow. Let's begin with the anatomy. In the upper extremity, we've already discussed the digits, hand and wrist. We are now going to move up to the forearm and the elbow. We will come back to the shoulder and humerus next semester in Chapter 5. So our concentration is going to be on the elbow and the forearm for this anatomy. In our forearm, we have two bones. We have a radius and we have the ulna. Inside the radius and the ulna are a few things that I need to direct your attention to. When we're looking at the radius is going to be the larger portion when it's closest to your wrist. On our radius, we have what's known as the distal radial ulnar joint. You will also notice that at the top of the forearm, when you're standing in the anatomical position, you have a proximal radial ulnar joint. We have styloid processes both on the radius and the ulna. If you actually hold your wrist out, you will see that there is a styloid process that protrudes out from your ulna. So let's work our way up on the radius. We have our styloid process. This middle section of that bone is called the body or the shaft. Up at the top there's a part that protrudes out called the radial tuberosity. We have the neck and then we have the head. On the ulna, starting at the distal portion, you have your radial styloid process. You have your head of the ulna. There's the ulnar notch, which sits right next to the radius. Your body, and then if you come up to the top, you're going to see that notch again. This is considered the proximal radial notch on the ulna. Your coronoid tubercle, your coronoid process, your olecranon process are all portions of the ulna. When you take a look at your arm in the anatomical position, so when we supinate our hand out, our two bones, the radius and ulna, do not superimpose. When you actually take your hand and you pronate, what happens is this crisscross motion on your bones, and this superimposes that radius over your ulna. This we don't want on an x-ray, and this is why we take our image AP so that they're not superimposed over one another. So here is some anatomy of the forearm. This is our AP image. When we take a look at this, you can see those two bones are not superimposed. Let's start up at the top on this radius. So here are those carpal bones that we just learned. Number 1 is your radial styloid process. Number 6 is the ulnar styloid process. Number 7 indicates the head of the ulna. Remember we had that distal radial ulnar joint. Number 2 is the shaft of the radius. Number 8 would be the shaft, or you can also refer to it as body of the ulna. Same with the radius. It could be the body instead of shaft. Number 3 is your radial tuberosity, which is this bump on that radius. Number 4 is your head of your radius. Number 5 is your capitulum. So I like to think of the cap sits on the head, that sits on the body. So cap sits on the head, sits on the body. Number 9 is your trochlea. Number 10 is the medial epicondyle, and number 11 is your humerus. So when you're looking at your trochlea, that is always going to be on the ulnar side of the body. Capitulum, cap on head, is going to rest on the radius. Your lateral view, the exact same anatomy. Here's your ulnar process. Right here is your shaft of the ulna. Number 3 is the radius shaft. Number 2 is your olecranon process. This is also your funny bone. When people hit that on the table, they'll often refer to it as you hit your funny bone. That's actually your olecranon process that you're talking about. Here's your radial tuberosity. And then in here would be your olecranon or your trochlear joint. So this is our fossa, and we're going to talk about that in just a little bit. So your semilunar or trochlear notch is what all of this is sitting in. So here's your olecranon process, your trochlear notch, your coronoid process, your radial notch. This is your posterior side of your ulna where the olecranon process sits. Anterior side is where that coronoid process sits. We're looking at the AP elbow. Here's the body of the humerus. Your coronoid fossa is that groove. Your radial fossa is the groove that's right next to that on the lateral side. You have your lateral epicondyle, your capitulum. Again, remember that your cap sits on your head, so here's your head of your radius. Radial tuberosity. Up here, your coronoid fossa, medial epicondyle, because it's on the medial side of the body. Here's your trochlea, your trochlear sulcus or groove, and this is all the ulna bone on the medial side. Your lateral elbow, here's that olecranon process. Here's your trochlear notch. Your epicondyles are superimposed. Here's your olecranon fossa. This is the ridge of the capitulum and the ridge of the trochlea. Your coronoid process, head, neck, radial tuberosity of the lateral elbow. So again, when we're looking at the radiograph, your epicondyles are now superimposed, but you can see the outer ridges, which forms your capitulum and your trochlea, superimposed. That sits inside that trochlea. Right here's your trochlear sulcus, and it all sits into this trochlear notch of your ulna. Anatomy of your elbow, same that we were looking at in your forearm. So here's your radial shaft, here's your ulnar shaft, radial tuberosity. We then have your radial head. Oops. Jump back here. Number 7 is your olecranon process. Number 5, that lateral condyle. 4 is your medial condyle. And number 3 indicates your humeral shaft. Lateral view, you have your humeral shaft, you have your medial suprachondral ridge, your coronoid process of the ulna, here's your head of the radius, down here's your olecranon process, number 2 is your radial shaft, and number 3 is your ulnar shaft. Couple joints that you should be familiar with. The elbow joint is a diarthroidal joint, but it also, your elbow joint has a hinge. So this right here's your hinge type joint, and it also pivots. So when we are turning it from supinate to promate, it's going to pivot. So here you can actually see, here's what your AP elbow looks like. Over here, when we start to do an external rotation or rotate it to the lateral side, you can see how that radial tuberosity is now separating from that ulna. And then if we were to do a medial rotation, you can see how they start to crisscross. So the two bones are superimposed for that internal rotation. The other thing we have to be cautious of when we're taking the x-rays is we like to see those fat pads. Those fat bands or stripes, they're radiolucent and they're going to be located by the joint capsule. A lot of times if we have injuries, these are going to be inflamed or enlarged. So when we're looking at the x-ray, you want to make sure that those fat pads are included. Usually you can tell if there's a fracture taking place because of the inflammation around those fat pads. So our technique needs to show some soft tissue in greater detail in order to demonstrate these fat pads. So here you can actually see there's a fracture of the ulna, and then the fat pads would be located around that region. So you have an anterior fat pad, a posterior fat pad, and that supinator fat stripe.